More than a year into working or learning from home, you likely know by now if completing tasks virtually is easier for you or more difficult.
Working from home has its perks as well as its drawbacks, especially distractions for those who already struggle with focusing, including those with ADHD.
If you or your child is having a hard time focusing, should you speak with your care provider about possible ADHD diagnosis? ClickOrlando.com's Rihanna Voles is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Attention deficit hyperactivity disorder can present itself in several different ways in both children and adults. Now, according to Dr. Dara Shah, a psychiatry resident at Osceola Regional Medical Center, which symptoms someone has and the obstacles they face because of them depend on the type of ADHD they might have.
So, for instance, you can have your inattentive subtype, in which an individual may struggle with focus, staying on task, managing multiple tasks, or become easily distracted by their external stimuli, just to name a few. And in the hyperactive/impulsive subtype, an individual may feel as if they're running as part of a motor, have difficulty staying still, feel fidgety. It might even be a child that blurts out the answers in a classroom before being called upon. And so when we make that diagnosis, we look at what the child is exhibiting symptoms of more so than the other when we look at the subtypes, or they may present with a combined presentation.
According to the CDC, hyperactivity in adults can appear more as extreme restlessness or even wearing others out with their own activity. And while it's possible to be diagnosed with ADHD for the first time as an adult, Dr. Shah says the first symptoms are usually seen before the age of 12.
And so in a lot of my high-functioning adults who come to our outpatient clinic, for instance, they may have come up with compensatory behaviors. So these are individuals who manage to sort of integrate these behavioral modifications. So perhaps they asked a lot of questions in the classroom. Perhaps they themselves moved closer to the teacher and they would spend hours and hours working on their assignments. So they were able to compensate for these behaviors. And as a result of that, they have been able to compensate into their adulthood. But perhaps retrospectively thinking about it, they may realize I did actually struggle with inattention, and I did have this difficulty as a child. Certainly circumstances as well may also highlight these behaviors. So I would just advise adults to think about any other coexisting issues that may be impacting their performance.
In other words, adults who are realizing that they might have ADHD tendencies really are thinking that they had these as children, they just went undiagnosed. But for children, it's often a teacher who first notices ADHD-like behavior. But if your child is learning from home right now, you could be seeing those signs yourself, or perhaps you're seeing them in yourself and wondering if you might have had ADHD that went undiagnosed. And Dr. Shah says, first off, consult your child's doctor.
So we have different scales that are questionnaires that should be filled out by the teachers as well as the parents in terms of their observations of the child's behavior and what they've noticed to be true. And once we integrate that information and are able to corroborate that diagnosis, then the next step will really involve a multitude of different efforts, some being medications, absolutely. So we have our stimulant medications, such as our Adderall, our Concerta, Ritalin. We also have non-stimulant medications as well that work differently, but still help increase that sustained attention. But in addition to that, especially in children, it's really important that parents work with the child and learn certain skills to help reward positive behaviors and discourage negative behaviors. As far as adults are concerned as well, Certainly the treatment options are fairly the same. Sometimes psychotherapy might also help, especially in people who may have gone undiagnosed, but in their childhood, but have been able to cope in a lot of ways. But it might be skills training.
Dr. Shaw also mentioned that signs of ADHD often look like other disorders. So the bottom line is, if you think you or your child are exhibiting any of the symptoms she mentioned and you think they're impairing your ability to get things done, talk to your doctor. And ladies, one thing that we didn't get to mention, but I wanted to tag on here, is that she did say you should see multiple of these symptoms and you'll see them in more than one environment. So maybe your child's teacher brought it up in the classroom before and you didn't think much of it, but now that they're working from home or you're working from home, you notice that it's also happening in a different environment. So just some things to look out for.